All right. Hello, everybody. My name is Ann Delos. I just want to make sure that everybody that you are seeing my screen. The first slide is building trust through conversations with our community. Jeanette, can you confirm that, please?
Yes, thank
Oh,
you.
oh, wonderful. Thanks. I have spoken to an audience virtually, and about halfway through, only then did someone mention to me that they could not see my screen. So I do like to check in advance. I'm going to change my glasses. These these have you can see you can't see very
Claire?
well, but a glare, thank you. Um, but I can see this way, so just to make sure that I'm on the right slides. I wanted to just a couple housekeeping things before I get started. I want to invite everybody to, if you have questions that pertain to a slide that I'm currently talking about or to the subject matter that I'm talking about, please go ahead and put them in the chat. I've invited, Jeanette's going to moderate for me, and I've invited her to interrupt me. I like to have a more interactive style if it's possible. I know that virtual doesn't lend itself as easily to that, but I wanted to let you all know to be comfortable to do that. I am very comfortable with interruptions and adjusting, so not a problem for me. All right. And the other thing I should mention to you, I know that there are studies that show that if you look up and to the left, it indicates you're insincere or even lying. My screen is up and to my left. So I'd like to clarify that I am not insincere in any way. All right, I'm going to get started then. Thank you, Jeanette. I'm really grateful to the Arizona Health Literacy Conference for bringing me the opportunity to tell you about a fantastic team within Maricopa County. The team is called the CARES team, and this team works to build trust with our community, one community member at a time. I'm Ann Delos. I guide the team. I am the administration and operations lead, and I have a degree in global business from Thunderbird at ASU and a 30-year professional background in global business. So including living overseas for 25 years. So I embarked on my new career in public health when I joined Maricopa County Department of Public Health to support the call center. That at the time, what the CARES team was called, the call center. And that team was created during COVID, as Jill Fernandez earlier mentioned, and thanks for the shout out, Jill. We were created to provide trusted information and resources to, honestly, a largely panicked community. And as Jill mentioned absolutely correctly, a lot of our work, sometimes our work was just someone to talk to. We had a very isolated community. Having a phone number where someone could reach out was fantastic for the community. So as you can imagine, I immediately saw the value of one-to-one conversations, the amount of trust that was being built among community members through the work of the call center team. And thankfully, so did MCDPH leadership. The call center in those days helped to clarify that just as a lack of trust can lead to poor health and lack of preventative care, the abundance of trust can support excellent health outcomes, such as in particular the increased immunization rates that the CARES team directly supports. So again, I'd like to thank the health literacy team for inviting me to share with you. And moving on, I'm going to give you a little understanding of who we are as the call center team matured into the full service capability that we offer today. We adjusted the name to the CARES team to better reflect the value of the organization to our community members. We were finding that due to the relationships we'd built within the community, we had established ourselves as a trusted resource and were receiving questions on a wider variety of topics than just COVID. In fact, we'd so well established ourselves as a source of credible information on health-related topics that our callers would bring a variety of questions to a single call, knowing that our team of community service representatives would have or find information that was helpful to them. So we kind of moved from being a traditional call center to the CARES team, to a resource center that was capable of responding to a variety of health-related topics. We also focused very much on building relationships with our callers. Each individual community service representative is encouraged to take time on the phone to build that relationship with each caller. And that's something that I'm personally really proud of, and I know the team loves to do. This is one way that we build trust with our community members, taking that time on the phone to spend time with them. Now, the other thing in the same vein that became very important to me was that regardless of which community service representative an individual was speaking with, I needed to make sure that every community member received identical information. So what we did in order to do that was create a mechanism for that I'm going to get into a little bit later. Back to who we are, I just want to let you know that we are open Monday through Friday from 8 a.m. to 5 p.m. and we average 500 to 600 calls with community members every day. I want to also do a quick brag. The team has won 3 fantastic awards. TAPI has awarded us for the 35,000 immunization appointments we made for children and adults in the year 2021, and also in 2022 for our MPOX response, during which time the team communicated guidance to over 30,000 community members and scheduled over 8,000 JYNNEOS vaccine appointments. And we received an award from the National Association of Counties for providing best-in-class community resource capabilities and amplifying the public's understanding of public health, elevating the awareness of available services, and building trust between the public and the community. All right, so we were established in 2020, and so far, we have scheduled over 105,000 immunization appointments. And of course, these numbers, I always hate to put these slides up because these numbers grow daily. But at any rate, as of last week, when I created this slide, we have had 299,813 conversations with our community members, and over 13 million people have been provided with information about community events. For individuals, so I will get into that 13 million number. I think it's a big number. Essentially what we do is we'll call, well, it's a threefold effort. Some of those are individuals that we contact because they're due for a second dose or because their child is due for school immunizations. Some of those numbers are large organizations, and that number is based on the number of their constituents or residents. We'll call an apartment complex, for example, and let them know that there's an immunization event happening in their neighborhood. They will then post information about that event and often will actually include it on their website or send an email to each of their residents. Not just apartment complexes, will contact libraries, schools, doctors' offices, businesses, places of worship, community centers, any organizations we can find in the area of a vaccine event. So that 13 million number is the number of people who would potentially have seen information about these events. So the other thing I should mention here is that in order to present this data, the team completes a survey after each and every call. And in that survey, they list call topic, caller type, whether it's a community member, healthcare provider, or school representative, for example. We'll list the caller's zip code, how the caller found us, what the resolution was to the call, and whether the caller received an email follow-up to the call. Jeanette, do we have any questions at this point? I'll give a quick pause.
You have a comment from Joe. So great to see you, Anne. My experience in the call center brought me out of acute care to learn the virtues of public health. Thank you for what you do and you and your team do every day.
Thank you so much, Joe. That's so nice. Was that Joe or Jill?
Joe,
Oh, Jill. Okay, okay, Jill. Thank you. Gosh, we were a great team back then, and we still are today. So everybody, by the way, I should also add, we're located in the 4441 building, the public health building on the 8th floor, and our door is also open. We take a lot of phone calls. The team loves to have visitors, so please pop by sometime. All right,
there's another question. How many people are handling the call center?
We have 10 operators. In addition to those 10 actually, I think that's the full, right now we're at 10. We do have one of those people is really focuses on our data collection and analysis. We've got another person who leads our outreach team that you'll hear a little bit more about when I go into it. So on the phone, we typically have between 8 and 10 people. And I'm going to just mention this right now. It's very interesting to me. I do not have control over our community members. So we receive multiple calls at once, and then we'll have a little lull. So the outreach side of what we do, we've got the inbound calls, and then we've got the outbound calls. So the outreach side of what we do is a blessing for us, because when we have that lull, we have other activities that will keep us busy and that will keep us communicating with our community. So the team loves that, and so do I.
Is your team still taking calls about COVID?
Oh, yes. In fact, I will show you some numbers as I get toward the end. I've pulled in one of our graphs that shows you what type of calls we receive that are COVID related, because I thought that might be of interest to you. We do still receive COVID calls. And I also, in that same graph, I will show you which calls are COVID related, which are non-COVID related, and the topics. As well as the MPOX related calls, which we also still receive.
Are you going to talk a little bit about the data that you just mentioned?
I am, yes.
Okay.
Well, I can go right to it. I just have to go through. Yeah, I'm going to wait. I'm going to hold off on that today.
Okay.
I will address it at the end.
Okay, great. Thank you.
Sure. Anyone else? Okay. Moving along. So showing you how we do it. One community member at a time is how we do it. When we first adjusted into the CARES team, I spent a lot of time researching what a valuable community-based support organization would look like. And these were some of the things that came from one of the studies that I read. So providing a single source of reliable knowledge base. So a friendly and sympathetic resource that is vetted and credible and uses continually updated guidance, the ability to provide science-based information and resources that lead to a healthier community. Alleviating the digital divide. So I wanted to make sure that we were supporting underserved populations and older adults, particularly in COVID. That was a major issue for us because the system to make an appointment for a COVID vaccine was extremely cumbersome. And we had a lot of, especially when we first started administering to 65-plus-year-olds, we had a lot of panicked callers who were unable to make an appointment for themselves. So I know Joanna mentioned the MRC, our volunteer group. We brought the MRC in to support that also. We had so many seniors, so they actually got on the phone with each individual and helped them to make an appointment. So also for those who may not have internet access, for the Spanish-speaking population, for hard-to-reach communities and low-income populations. So making sure that we were able to serve all populations. And I should mention that the team here, 50% of them speak Spanish. Probably about 40% of our calls are in Spanish. We also have one Vietnamese speaker, and I am working on bringing in additional languages. So then the third pillar, as I came up with it, was offering excellence in community service. We do this through our hiring program, our retention program, and our training programs. And I'm going to give you a brief glimpse into those.
Do
Our
you
data
capture race and ethnicity?
No, we do not. We don't. We do capture language, but we don't capture race and ethnicity.
Okay, thank you.
Data collection, the plethora of data provided by the CARES team is a proactive method of identifying community trends and most frequent questions that inform Maricopa County response teams. So as an example of this, we had during COVID, our data was indicating that we were having an increase in calls referencing the J&J, the Janssen vaccine back then. At that time, public health was looking at, as a lot of other health agencies were looking at, moving away from the Janssen vaccine and focusing on Pfizer and Moderna. Based on the information that I was able to provide and what appeared to be a trend of renewed interest, the public health decided to keep Janssen for an extra 4 months, which was really great because we did in fact have additional interest that that trend was an actual trend that we had seen. So making sure that we've got the data that both informs public health of what topics are of interest to our community members, as well as providing public health with trend information and community-based information that helps to inform public health about our own policies. Now, I mentioned guidance to you, and this is, I hate to show this slide because it's a little bit, this isn't really what it looks like. This is a screenshot where I had to really minimize my screen in order to fit these 3 sections on. So it is a much neater thing to look at. But at any rate, what this shows you is on the left is our COVID-19 vaccine FAQs. So these are links where there is current information about COVID-19 vaccines. In the middle section and across the top, those are our, this is created in OneNote. That's essentially a chapter. So where you see business vaccine providers, call center policy, clinic FAQs, community resources, etc. Those are chapters. Within those chapters, you will see pages. That's the section in green on the right. So those are the types of questions we'll receive about COVID vaccines. So we've got them all organized in there. This guidance, the reason we have those huddle meetings, the first pink slide or tab across the top, every day we have new guidance. Believe it or not, even after COVID, every day there is some adjustment to our guidance. Most days it's minimal. But of course, then we have the ACIP meeting, was it this week or last, that completely causes us to recreate a whole bunch of pages of our guidance. So one of the community service representatives takes responsibility for helping with that and making sure that our guidance is always current. That is based on any links that we have in it. Happily, our website is updated very regularly. So when we send an email to a community member after a call, they will have the ability to find the most recent guidance. And I should have mentioned that we send emails to callers when we look at links, web links, we'll talk the caller through the web link. And after that call, we will follow up with an email if they would like to share their email address with us. We'll provide them with the information that we referenced on the call. And those are only links. We will not include any additional information because we don't want callers to have information that might be replaced with new information over time. We want callers to have the links where they can get that additional information. We use only trusted sources, U.S. government, state, and county. However, we also will not leave a caller without some source if we can find it. Even if we don't have it in our guidance, we will search and we will find a trusted source, government, state, county, in order to provide any caller with current information. It is very rare that we cannot find some information for every caller. Every now and then it happens, and I'll show you sort of the range of topics that callers will present us with. It's true, every now and then we get a topic where we're like, we don't know. We'll do the research. Most of the time we can find some information for them. And then that information goes into our guidance. So it's a well-oiled machine surrounded by chaos sometimes.
And can you report on the types of questions that are coming through?
Yes, I can. I'm going to rush right down to that slide. Let me get it to you. Okay. So here's one I created with some word bubbles. Actually, Monique, our data person, created this for me. So on the COVID side, you can see we receive a lot of calls on testing, appointments, reporting a positive case, home tests, child COVID vaccines, booster shots, a wide variety. On the non-COVID side, on the right, a lot of general guidance, immunization appointments, travel vaccines are big, records requests, women, infant, children, WIC program, rabies is a frequent call. We receive calls on diseases, and we are the response team for epidemiology. So any disease that's named in a call, we will pass that caller on to an epidemiologist to receive full information. We also have what we refer to as the bat phone. Don't tell our epi team that we call it that. I don't know that they like that, but anyway, I've done it now. The bat phone is for healthcare providers and some community members as well. And that is a different line from our line. It rings to all of the team at once. And if there is a bat phone call, it is typically a healthcare provider who has a rabies case sitting in their office or some sort of reportable disease. So
we have a comment and a question.
Okay. Oh, what are they?
I'll read it. I'll do it. Sorry. Johanna wanted to let everyone know that, and you, that for our immunization equity events, we list the number for the CARES team so that people could call with questions about events, dates, locations, etc. They do great work informing the community. That's a good takeaway for other organizations to be able to share that information, knowing that this is a trusted department. And then there's a question. Someone would like to connect with you about how you developed the knowledge database and what tool you used. I don't know if that's for this conversation or offline conversation.
Well, we'll take it offline, but I am so thrilled to get that comment question. I would love to. And I have always thought that what we've created is scalable to other organizations. It is a task to keep it updated. And, because it's part of our job, we do a great job of that. But I would be happy to pass along the guidance, at least even portions of the guidance that we have created. I have no problem whatsoever sharing that and just making sure that it's constantly updated. So maybe just the link portion, depending on how much of a team you have, if you have someone who is capable of regularly updating it. It's created using OneNote. It is a Microsoft application, so it's really easy to recreate. But yeah, I'm more than happy to share that, and I'm thrilled to get that question. That's been one of my goals, is to share this. Let me go back up to, where I was. All right. I just wanted to make a note that one of the ways we build trust is through our well-trained customer service team. So we invest in training and and just make sure that the team is comfortable, particularly with that critical thinking, ethics, of course, and managing vaccine hesitancy is sometimes valuable. Emotional intelligence is always valuable on this team. We do have at times difficult calls. The team is phenomenal at being a team and at helping one another. And it's a pleasure to see. Now, I've mentioned how we track each call. This is the graph here shows you a breakdown of COVID versus non-COVID versus Mpox calls. I should mention that the Mpox, the 20,000 call, we do not have the capacity to take more than 20,000 calls in a month. So some of those are emails. We reverted to an email system where we could help people to schedule appointments. We'd send an email and say, check a box, which of these appointments do you want? They'd return the email to us and we would schedule the appointment for them. If those boxes didn't work for them, they would return it to us. We would make a phone call and find an appointment slot for them. So it just made us a little more efficient during a time of high need. So during responses, we get very, very busy, which is great. We love it. But we also look for how can we make sure that we respond to as many people as possible, recognizing that we can't always do that by phone. So on the left, I just wanted to show you our call topics. This is specific to non-COVID. So in our survey that we fill out, we've got was it a COVID call? And that's where the call topics go from there. Was it a non-COVID and was it an Mpox call? Now we've pulled Mpox back into the non-COVID. We don't have too many of those. So I mentioned the BAT phone, environmental services, flu, general guidance, HPV, shingles. You can see all of those areas where we will receive or topics that we'll have. So I mentioned that we track every call, and I mentioned that we identify trends. I should also point out that our quarterly and annual data and analysis provides critical information to grant managers as well. So when we have someone within public health with a grant that needs to demonstrate specific community-driven results, our data helps to do that as well. So I love that about our data capability. Okay. Now, I wanted to show you that we do have a lot of repeat callers every year and a lot of referrals every year. And our discovery sources include the website, our bookmarks, and Joanna's event flyers that she mentioned in that comment. I think I've pretty well covered our inbound calls, our outbound calls, our data collection reporting, and I'm going to get into our emergency support capability. First, I'm going to give you just a quick additional information on both the data collection and the outbound calls. So bear with me. I got to show off our data collection. So this is information on zip code. And again, I wanted to show this slide because I thought this information might be valuable to some of you. And if it is, again, we are happy to share. This is information that I would be delighted to share if it would be helpful to you. So we started collecting zip codes because we have the liaisons and Joanna's team within public health that are working throughout regions and often by zip codes. So this information is showing on the left, the top 20 zip codes for inbound COVID calls, and on the right, the top 20 zip codes for inbound non-COVID calls. Now, of course, we can drill down in this data. What are in the non-COVID calls, what are the top call topics, for example? But it provides indication to Joanna's team and other our public health liaisons on do they need to be doing some additional outreach in a specific zip code? Are there unmet health needs in a specific zip code? Do we need to add partners in a specific zip code? So, and it is only indicative. We cannot draw conclusions from this, of course, but when we drill down into more of the intricate details, I think it is valuable to our liaisons to know, for example, if 85037 zip code has a huge amount of calls that are, I don't know, environmental perhaps. So just having some information that might be valuable to our liaisons and possibly to you all as well. Outbound partnerships. So building trust with and through supporting our Maricopa County partners. These are some of the organizations that we work with, and this is specific to those outbound calls that we do. So our childhood immunizations will call the families, the parents of 5 and 11-year-olds who are due for school vaccines that year. We try to launch that project early in the year so that we help to alleviate some of the stress on our clinics, because everyone wants those in August, September, October. So we try to alleviate the stress by getting kids in early, especially over the summer. Our immunization equity project team, that is Joanna's team. We work really hard to promote her events. We also, if we have a caller who is looking for an immunization and we've got an event going on, we'll send them to that event and make sure that they're aware of it. So if it's in their neighborhood, we get them. We try not to send people across county, but we do, if it's in their neighborhood, we will encourage people to attend those events.
Anne, we have another question. It's from Paula Davis. Just curious, on the green graph, what's the socio-economic and racial characteristics of the top 3 zip codes?
I don't know the answer to that, but our public health liaisons and Joanna's team would. So, and I think one of the interesting things about Phoenix is every zip code has a wide variety of socioeconomic, a wide scale.
Right.
So I don't know that we can draw information based on that. I know we have a couple of zip codes that we on the CARES team try to focus on because we know that we have greater needs there, but I can't answer socioeconomic across each zip code.
Yeah, and I think if someone does want to know, like they could probably go, ADHS has some great dashboards, and then the census has great information.
Yeah, I don't look at that too often. So going back to our partners, we supported both the heat release survey and the community health needs assessment survey by mentioning those to every caller who contacts us. So no caller got off the phone without hearing about the CHNA. We wanted to make sure that we drove numbers up, and we're doing the same with the heat relief survey. The WIC program we support with an outreach program, and we started a second dose vaccine project this year that was really to make sure that no first dose was wasted in a 2-dose series, that we follow through with each individual in order to get them a second dose. I'm really proud of that program, and I think it was a great idea to embark on that. We find that with a personal contact, we do get second dose vaccines completed or the series completed at a higher rate. So I think that's fantastic. So I don't need to show you this slide. This is just sort of showing you the numbers of community members that we reach on a monthly basis from the inception in April 2021. And again, if I showed you this over the number of calls, it's not necessarily reflective, because some of those months we're making those individual calls, where other months we're making the calls to apartment complexes and community centers and businesses and so on. So the number of people impacted is variable, but our call numbers each month remain about the same. Finally, almost finally, Our emergency support capability. So this is a growing capability within the CARES team. It was something that CARES, when I first came up with the name, stands for Community Action Resources and Emergency Support, because I felt strongly that we have the capability to support our community anytime they need us, regardless of what is happening. So our continuity of operations planning means that if this building, the 4041 building, closes down for any reason, we are capable of working remotely. We've got locations set, we've got equipment set so that we can do so. And we actually did have a shutdown. So I tested this and it works. The mass casualty incident support is something that we're working on to make sure that we have the capability, but that is a project that I feel passionately about, and it is to make sure that our community members have that immediate support in the event of a mass casualty incident. That would be before, for example, the Red Cross. Other organizations will, of course, come in and support, but having a phone capability that is immediate, I think is really important. So we're working to establish and solidify that. And now, almost finally, I just wanted to show you some of that. We also do a community satisfaction survey when we send those emails, and we send an email, I think I mentioned, to close to 50% of every call receives a follow-up email. When we send that survey, we invite community input, and it's a 5-star, so they can just hit the stars, or they can go in online and actually fill out more information or comments. So I just wanted to share some of the wonderful comments that the team has received. Yeah, I think our community likes us. And now finally, we have bookmarks. So we created these bookmarks because we had a lot of requests for them, and we've now done, it's nice to have a professional bookmark. These are Spanish on one side, English on the other. We give these out for free in bundles of 250 to 2,500 to community organizations, schools, doctors' offices, libraries, apartment complexes, and many other groups. We encourage everybody to have some of these on hand. If someone asks you a question that is health related, you can hand them one of our bookmarks and we will provide them with an answer to the best of our ability. So, and I mentioned our team is bilingual, and we do have access to the language line so that if we have French, Arabic, Swahili, other languages that come on, we are capable of responding. We also have a TTY line that is listed on that bookmark as well.
You have some questions in the Q&A?
Mm-hmm.
Let's see.
Wait, I think I have it open. All right.
Okay.
I try not to get myself distracted in the middle of a presentation. So no, I think these are old. I don't have the updated.
Okay, I see that. Do you track individuals who call more than once?
Yes, we do. So one of the questions in terms of discovery is, are you a repeat caller? So that was, I thought I had a slide on that. Oh, here we go. So our repeat callers, we do track those, and we track referrals, and I mentioned the other discovery sources. We love our repeat callers. Well, we love all our callers, but it's nice to know when we have a repeat caller.
And let's see what else. It's kind of jumping around a little bit here.
Sorry, whatever setting I have, I'm not seeing any of those, so I'm just going to let you tell me. I'll go into the chat. Why can't I find it?
I thought there was another question about, well, actually there was a comment that if you could put your contact information in the chat, and then also I just wanted to double check and make sure that it was part of the slide deck, so people will have that.
Yes, it is on my last slide.
Okay. There's a question about census information. I think you said maybe some of your liaisons use this, so might not be able to address it. Is your population dense enough to collect data along census tracts too, in order to ascertain true needs for intervention? I ask because in my city, we've done this and it's gone from broad zip code based disparities to specific census tract disparities that are far greater than previously realized. That's good information.
Okay, I think that's a great question, and I really don't know the answer. But I would love to look at that to see whether there's additional work we can do on that.
Yeah, that's a good question. Okay.
Okay. I am, what, 4 minutes?
4
that
minutes out. Are there any more questions? I did see something come through earlier. Do you have any results of the second dose of COVID? Any results?
Oh, I do. Let me, so here are I just wanted to show you this slide real quick, the COVID call topics. So testing guidance, child vaccine, adult vaccine, and boosters. So this slide gives you kind of a quick overview into call topics that are COVID, Mpox, and non-COVID.
Okay, thank you. And then all this data, I mean, I know I'm sure you use it internally, for planning purposes, outreach purposes. Does it go anywhere else to legislature for any input to policies or?
No, it does not. It is certainly available. Everyone. So we do a weekly, we call it the war report, the weekly activity report, that goes to all of leadership within public health. So they have access to that information. I would say that it probably informs discussions, but and hey, if they use it, I don't know, and they're certainly welcome to.
Okay, thank you. So thank you, Anne, for great presentation, great work that your team is doing, and you, of course, and the collaboration with you and the other organizations really make for a unified front and trusted front. So supporting each other is critical in this, process.
Yeah. Yes, thank you for noting that, Jeanette. And I so much appreciate your willingness to be a little less formal with this. That worked great for me, and I hope it was a great experience for everybody in the audience as well.
Yes, thank you so much. Let's see, the next presentation is, oops.
I can't stop sharing my screen. I'm just
It's fine. I just want to, oh, we get a little break for lunch, and let's come back at 1 o'clock for our next hot topic presentation. So
By then
1 to 1:30, we have a hot topic, Earn Our Trust, the perspectives of patients and caregivers. Thank you, everybody, for the morning session, and you all been awesome. And please continue to stay in the conference.